care catchment regions in the United States had #1 highest cardiovascular mortality, and it was in the top 10 amputation rates in the United States. In the last survey, we were #4 lowest cardiovascular mortality, and we're #1 lowest amputation rate. Those are by far the greatest deltas in the entire database, by far, nothing close. Those places that were 1, 2, and 3 were 1, 2, and 3 30 years ago. They were healthy places like Denver and places like that where people exercise. It's a big accomplishment. I promise you that didn't happen in Louisiana because we started eating better or exercising more, including myself. What's amazing is where things have gone. We've now treated people from every inhabited continent. We've treated people from every state in the United States. They've come here seeking care, and many have come here from huge institutions. Look at some of those pictures. The man who founded WebMD is a patient that comes to Houma, Louisiana, after several places told him his only option was to have both legs cut off. He is still walking. He walked in yesterday. We've treated people from Saudi Arabia. We've treated people from really the whole world. So that being said, Hu Dai Li, I'm getting off the speech now, but from the first Chinese textbook from 2,500 years before Christ, stated that the inferior doctor treats aggressive illness, the mediocre doctor treats impending illness, and the superior doctor prevents illness. And if there's a focus that I would like to see us move as we go forward, is to be the superior doctor, and that is to prevent illness. It is far easier to do a good job and to get a better outcome if we can prevent illness, and if we wait until we've already had destructive effects of illness. We do believe that it's important to diagnose and treat and save limbs and lives, and to perform our research and to give education, and to ensure that the dreams that we founded early on and have coalesced live on. In line with this mission, we've begun a PVD, or peripheral vascular disease mentorship program in China. In fact, we established, if you look on the far panel, the very first limb salvage center in the entire country of China. CIS did that. And we offer many new state-of-the-art programs to increase access to care, improve outcomes, and enhance communication between the patient and the provider. All of these are important, no matter how technologically capable one is. If one cannot communicate that with the patient and make the patient understand why they need to treat themselves with the suggested treatment modalities, then it's all for naught. As we continue to expand, we can take pride that we've grown into one of the largest and most comprehensive cardiovascular programs anywhere in the world at this time. This is because of our dedicated physicians, our incredibly committed team, and our loyal partners. Thank you from the bottom of my heart and the heart of all of us here at CIS for your support, and we look forward to many more years of caring for people in this area and hopefully helping to set a new benchmark for what cardiovascular care should be. What a momentous occasion. Really, I look around and my heart both is elated and drops as I look at some of our fallen that have worked with us all of those years. But what a remarkable trip this has been, and I hope 35 more years from now I get to speak to you again. Thank you. Bye-bye.
What a great story, and certainly congratulations are in order for CIS. We'll take a short break. When we come back, we'll have a few pictures to show you before sports. We're going to go to Thibodaux, where my mom and sister represented our family as they had a large gathering to wish Aunt Cecilia a happy birthday. We'll be right back.